Good morning, Chairman Alexander, Ranking Member Murray, and fellow Senate committee members. And thank you for inviting me to share my company's story and my testimony about why I think it is important not to modify the definition of full-service employee as outlined in the Employer Shared Responsibility Requirements of the Patient Protection and Affordable Care Act. My name is Joe Fugere, and I'm the founder and owner of a business in the other Washington State. Just celebrating 11 years in business, Tutta Neapolitan Pizzeria is a neighborhood restaurant group made up of 5 locations in the greater Seattle area with just over 200 employees. Let's start with the fact that when it comes to the American people, and small businesses in particular, that I'm an optimist. In my employer peer group in Seattle, I know business leaders who are driven to do the right thing. Not always because they reap short-term rewards, but because they know that their employees are the foundation of helping them achieve their true purpose and values and making all of their stakeholders successful over time. I believe that the Affordable Care Act was a step towards giving some support to the uninsured in our country, but it also encouraged business owners to do the right thing. At Tutta, our stated purpose is to nourish lives by sharing traditions, authentic food, and love. We aspire to enrich and invigorate communities by providing memorable experiences. We hope to inspire others by setting a standard for social stewardship and fiscal responsibility. Part of the reason that I'm here today to testify, and I agreed to testify, is because I think it's important to share our story and share some real-world examples of this vision in action. We've been offering healthcare, medical, dental, and vision benefits to our salary managers since 2005 and to all of our hourly managers since 2008, well before the passage of the Affordable Care Act. We set the minimum hours threshold for healthcare qualification at 24 hours per week to maximize the number of enrollees. As a company, if we raised it to 40 hours, almost every one of our current hourly employees would not qualify for enrollment. I think it needs to be stated explicitly that this industry has and always will be comprised of part-time workers. It is inherent in the fabric of restaurants to accommodate a workforce that often craves a more flexible schedule, students, caregivers, aspiring artists, for example. I understand that the backers of this legislation believe that it would give 2.5 million low-income wage earners a raise. The reality is that very few employees in our industry would be scheduled more than 30 hours a week, regardless of the threshold. Our industry is teeming with employees from the millennial generation. In a recent article on BusinessInsider.com, the U.S. Bureau of Labor Statistics predicts that millennials will make up approximately 75% of the workforce by 2030. The article also mentions that this generation is struggling for financial independence compared to previous generations, with 24% who participated in a survey reporting the need to move back home at some point after entering the workforce, versus 10% of Gen Xers and 5% of baby boomers. At the other end of the age spectrum, some employees in the restaurant business need to continue to bring in income even after they start to reach a more standard retirement age, or as they start to reach a more standard retirement age. I can think of one of our longest and most loyal employees, Renee. When I was opening our first location in the Columbia City neighborhood in Seattle, Renee was so excited about Tutta opening in our neighborhood that she offered to work for free. I didn't take her up on the offer of free labor, but she did become our first server. 11 years later, Renee is now 60 years old and has become a cornerstone of our culture and beloved by our staff and guests alike. She has been fully enrolled in our benefits package for years, and it is a huge relief to her as a single person. Even if it was possible to schedule an employee like Renee at 40 hours recommended in this amendment, it would be a challenge for her physically to manage working that many hours. With the U.S. restaurant industry projected to have employed over 13 million people in 2014, that's about 1 in 10 working Americans, it pains me to think of the potential hundreds of thousands of people like Renee who would be impacted by this change in definition. There's limited evidence that the current healthcare reform has caused any significant shift towards part-time work in any industry. Rather than focusing on the few employers who will be led solely by profits and cost savings, Let's focus instead on those employers who I believe make up the majority of business owners in this country. The ones trying to do the right thing by investing in their employees while at the same time reaching their financial goals. It's a balancing act for sure. I work hard to achieve this with my team every day. But I've seen the direct results of offering a robust healthcare package, higher morale, lower turnover, increased productivity. You can really take that to the bottom line. Not to mention the big, bright smiles of healthy, happy, and productive employees. In closing, I want to be a business leader in a country that is progressing as a society, not taking steps backwards. As we continue to shift more towards a service-based economy, we need to provide people in this workforce more opportunities to be successful and healthy in the years and decades ahead. 1 out of 33 people in the state of Washington are food service employees. As one of those, it would be my dream if we all did the right thing.